Hey guys, Dr. Josh Jagoda here. Welcome back for this week's episode, and today we're going to discuss the treatment of an armbar or hyperextension injury of the elbow. So in our past episode, what we did is we talked about the actual presentation of the elbow and the actual evaluation of it, and it's fairly simple, but just to recap, patients are going to be in this protected mechanism where they're kind of hike their shoulder a little bit, hike their elbow so that it will not extend any further, and you're going to see that a little bit in this patient today. So if this patient extends this other elbow, you can see almost full-blown extension, whereas this one, it's kind of locked up into place. And so patients will be really tender on the inside, and we're going to discuss how to treat it with the Graston technique today. So what we'll do is we'll start with the bicep. The first thing you're going to want to do is apply some emollient to the area, the injured area. You want to release the bicep because the bicep is also responsible for flexing the elbow. So if a patient's stuck in this chronically shortened position, what we're trying to do is extend it. We're also going to be working on the flexor group here. So let's start with the bicep. Keep in mind that this is not the inflamed structure. So we can go a little bit harder, a little bit deeper, depending on the individual. But because it's overworking, or this bicep's overworking, what we're going to do is we're going to support it, and we can go a little bit harder, but we have to keep in mind that it may be overworking. First thing I'm going to do is I'm actually going to put this arm on my side of the hip, and I'm going to open this patient up. I'm going to support the elbow because you want to always support the injury. The patient needs to be comfortable. And what we're going to do is just apply some gentle force to the bicep, both the inside and the out. And you will feel, and the patient will report as well, that it's a little bit tender, a little fibrotic, usually right in the muscle belly because it's contracting a lot more than it should. You feel that? And so we'll go kind of on different angles, and we're going kind of hard, not terribly hard, but and we're doing up and down, left and right. We're switching our angles to get that bicep to release. You may want to work up into the shoulder a little bit as well, but in this case, just for this demonstration purposes, we're not going to. So now that patient can feel a little bit of release in there. What we're going to do is we're going to go down into the forearm. We're going to work the lateral aspect of the forearm working medially. We do not want to really cross that midline at this point in time because we want to pay special attention to the ulnar collateral ligament right there that was injured at the armbar injury or the hyperextension injury. So we're going to go up and down, working the lateral aspect, especially because the bicep attaches right here. This will give it some more release as well. And then we will work medially. When I work on the inside part of the arm, what we're going to do is we're going to work from down, working back towards the injury. Keep in mind that this is the injury area, and what's going to happen is that patients will be really sore. So the pressure that I was using here and here, I cannot use here. This is the inflamed structure. We're treating it as if it is inflamed and a new injury. So when that has happened, you have to take the weight of the tool and go really gentle, almost like this, almost barely, where she barely feels it, but you'll still feel the tension and the strain there. I'll work in different directions, and it may look like I'm not doing anything, but it's quite effective. And if you do too much, keep in mind that this structure is going to really show some poor results because you are already irritating something that's really been heavily damaged. So we're trying to prevent that damage and increase the patient's mobility. I will possibly grab a smaller tool, get into these small joint spaces. Keep in mind that you do not want to compress or push onto the ulnar nerve in this general location. And so I'm going light. In all cases, or most cases, you want to work one of the antagonists, meaning the triceps. So what we'll try to do here is we'll take some of the emollient, we'll put it a little bit on the back, and we'll also work the back of the tricep here towards the elbow because we're trying to maintain good quality joint health of that elbow. So after treatment, what I'm going to do is I'm going to maybe do some stripping. You want to work a little bit towards the elbow, towards the inflammation, pushing all the inflammation back towards the heart if there is any swelling. But you definitely do not want to compress too much on that ulnar collateral ligament. And you can already see that the patient's ability to open up and just this demo is a little bit better. You can see that little end range of motion has improved. So this is how to treat an armbar or hyperextension injury. Catch us next time and I will show you how to tape for this type of injury so that you prevent more extension. So if you want to go back into training or you want to do some activities with weight in your hand, that you can extend it but you can still protect the structures on the inside. All right guys, thanks for stopping by. I will see you next time. Take care.